post-exposure prophylaxis?
Yes, PrEP is pre-exposure, so that means before you get exposed to HIV. So you want to prevent it. That is the PrEP that you just mentioned. And indeed, what is also available is post-PEP, post-exposure. So after the event, so let's say victim of sexual harassment, for example, and were at risk of getting STDs. If you get treatment with the same medication or with similar medication within ideally 48 hours, ideally as quick as possible, but sometimes up to 72 hours, it can prevent you getting the virus in a lot of cases. So that is good to know, that if you ever had a situation where the condom broke or anything else happened where you later thought, or maybe you were intoxicated and your decisions, it's not always about harassment. Sometimes life happens. There is still options to go to a clinic to ask for PEP. I would expect that would be the same place where you also get PrEP in India.
And how does the protection work in PrEP? How often do you have to take it, and when are you protected?
So there is two ways of taking PrEP. PrEP is one pill, and you can either take one pill daily, and then you're always protected, so to say. So that is the easiest. When you start PrEP, it is important that you first do a test, an HIV test, to make sure that you don't have it. Because of course, if you start taking medication to prevent it, but you already have it, that is not good. But the organizations that provide PrEP would always guide you with that. So the one option is taking it every day. It becomes fully effective, I think, after 5 days. And the other option is that you only take it around situations where you know you're going to be sexually active. So if you're someone that doesn't have sex that much, let's say you only have sex twice a month, and you feel like, well, if I only twice a month I go to a specific party or I meet with this specific friend who's visiting, then for some people, it feels like a burden to take a tablet every day for something that is occasional. In those situations, you can take intermittent PrEP. That means you take 2 tablets 2 hours before you're having sex, and then 24 hours after you take 1 tablet, and 24 hours after you take 1 tablet. So that is 4 tablets in total. 2 tablets 2 hours before, 1 day after, 2 days after. So, and that also gives the same protection for HIV. It's important to know that PrEP protects you from HIV. The hepatitis B vaccination can protect you for hepatitis B, but PrEP doesn't protect you for hepatitis B, and PrEP doesn't protect you for syphilis or other sexually transmitted infections. So the most important reason why people take it is because they know that syphilis, for example, you can treat with antibiotics. Other sexually transmitted infections like chlamydia or gonorrhea, you can also treat with antibiotics. But HIV is a lifelong infection as we know it. So that's why they say that's more important to prevent, because we can't cure it. Whereas the other ones, you could get a treatment.